This is the Utahns Against Hunger issue forum on food insecurity and impacts on health. My name is Neil Rickard. I'm going to be your moderator for today. I'm the child nutrition advocate here on here at Utahns Against Hunger. And now to introduce our panel, first we've got Matt Lewis from Sacred Circle.
Yeah, my name is Matt Lewis. I'm a dietitian here at Sacred Circle, outpatient dietitian. See a wide range of a lot of individuals and definitely a lot of individuals with lower income.
Great. Next, we've got Noah Materko from the American Heart Association.
Thanks so much for having me, Neil. Hello, everybody. I'm Noah Materko with the American Heart Association. I'm our government relations director, so I work on our state and municipal policy level initiatives to improve access to nutrition, among the other things we do. We also have other folks at our organization who work on community programs, education, and things like that.
Great. And finally, we've got Rachel Bowman from Utah WIC.
Hi, Neil, and everybody. Thank you for having me. My name is Rachel Bowman. I am a registered dietitian and also an international board certified lactation consultant. I have been a registered dietitian for about 13 years, and 9 of those years have been working for the Utah WIC program. And I'm currently the nutrition coordinator for the Utah WIC program, and WIC has 47 WIC clinics throughout the state of Utah that I help oversee the policies and manage.
Great, great. So I think we'll get started from there. And like I said, this is the issue forum on food insecurity and impacts on health. And I know that when we use the term food insecurity or hunger, it creates a very evocative picture in people's minds, and many times what we're trying to, because it's a serious issue. But there are also a lot of more subtle or not as readily apparent effects that food insecurity creates. And I wonder if you guys can speak to some of the more long-term or hidden effects of food insecurity on health. Let's see, I'll just toss it up to anybody who's ready to talk. I'm not going to call on anyone.
Sure, I can talk about some of those specifically. I think the short-term effects that you mentioned, we see this a lot in kids, like dropping blood sugar when they're not getting regular, consistent meals and snacks. They can kind of have that fatigue or just kind of low energy, which can impair for our young children, it can just impair their behavior as they get into school age. I think we see that impacts their ability to learn and grow and develop. And so we see poor grades in school in kids that experience food insecurity. And then as you move into adulthood, I think the big things that we see is that just food insecurity and poor nutrition can lead to obesity and other long-term chronic diseases like heart disease or stroke, high blood pressure, diabetes, or certain types of cancers.
Yeah, and I think just kind of piggybacking off of what Rachel had mentioned, just increased risk of some of these diseases. With a lot of my pediatric patients that I'm seeing, we're starting to see more and more of things like non-alcoholic fatty liver disease, which is really concerning at such a young age, hypercholesterolemia, insulin sensitivity. So just lots of issues that are starting to develop early, starting to show those early signs, and can really become an issue later on in life.
Yeah, those are both really good points. And so we know hunger doesn't always look like hunger, and that's sort of the opening of your question, Neil. So we know that it's a widespread problem for both children and adults, alarmingly so for children. And when we look at children, we know that the American Heart Association, a lot of our concern stems from the obesity, the hypertension, the diabetes, the things that can happen over time through a young adulthood of hunger. And food insecurity is a stressor. Food insecurity is associated with a much higher risk of anxiety, much higher risk of depression, and that's for adults and for children as well. I mentioned at school, behavioral issues like hyperactivity, anxiety, aggression. And a lot of the way some of our schools are set up is that students who are struggling in these areas aren't necessarily set up for successful futures. So we want to make sure that we're addressing those issues early on.
So I'm the child nutrition advocate for Utahns Against Hunger. One of the things we're working on very actively, in fact, with you, Noah, is school meal policy, and they're trying to expand school meals here in Utah. But what I've heard a lot about are children's issues specifically in the context of food insecurity and lasting impacts. And I'm wondering if you guys could elaborate a bit more on the ways targeting food insecurity differs when you're focusing on kids versus adults specifically. Are there different methods that you think should be employed? Are there different areas of concern that are more pressing importance in your mind than they might be in adults?
Yeah, I can hit on that real quick. So I'll just kind of hit on a little bit what I do specifically with my pediatric population. I generally like to have the parents, the guardians come in with the child. And I really like to just kind of lay out the importance of nutrition and why that is, why they might want to aim for some of these healthier foods, more nutritious foods. We kind of go through building my plate and just getting a good understanding of what the different food groups are and why it would benefit them, just so they have a good idea of what's going on. And then I really like to work with the parents because the parents are providing the food. And so just helping the parents understand what a balanced meal would look like, how to offer that to the kids, and basically just let them be introduced to these healthy foods and see the family eating these types of foods, and allowing the kid to work on some of those behavior modifications as they work on healthier meals and increasing the nutritional intake of that child.
And I think to add on to that, in WIC specifically, we are seeing more and more behaviors that are maybe worrisome, such as like a binge eating or secretive eating or food hiding or nighttime eating with children that maybe have food insecure situations. And oftentimes when you look at research studies, these behaviors are not shown in families that don't have food insecure situations. And so I think it's addressing these types of behaviors with the parents as well and mitigating those. I think one of the overall arching themes that we do at WIC is just the importance and value of regular and consistent meals and snacks. And that can be a huge barrier for a family that's insecure to have that regularity and that consistency for these children.
Yeah, when we talk about hunger for youth, we know that, for the students who rely on school meals through the community eligibility provision or the National School Lunch Program, those meals that they're getting hopefully 9 months a year can be an absolute lifesaver. And that highlights the need to address filling those needs during the summer months when students aren't really going to school regularly. And when we talk about high-level policy solutions, we do talk about expanding eligibility under the CEP and the National School Lunch Program. And that's something that we've seen our neighbor states do, either through ballot initiative or through legislation. And I think that's something that hopefully we're working towards being workable here in Utah, even if it's in baby steps. But school meals can be an absolute lifesaver. For the most part, they're more nutritious than what a lot of kids are getting at home. And we can do a lot more to reduce the stigma that are associated with those programs as well.
And I think, so you guys are talking a lot about both high-level interventions targeting behaviors and eating habits and much more in-depth ones. But this sort of describes to me a very complicated system that you're trying to address. Like there've got to be a really tricky select ranges of opportunities for intervention in terms of healthcare. I know that a lot of healthcare providers are trying to fill gaps and address that. There are some programs where healthcare providers are trying to screen for food insecurity and refer to services. I know there are produce prescription programs trying to encourage like food as medicine. But I'm wondering what you guys think of the role of healthcare providers in this broader systemic approach to addressing food insecurity. Are there a lot of gaps remaining? Are there like good good places for healthcare providers or other people addressing dietary habits to step in that we're not tackling? I just want to solicit some of your thoughts on that.
Yeah, no, I think that's a really good question. A lot of times the providers are the first person that they see, that this food insecure person may see. And so really, that's a really important time for them to pick up on possibility of food insecurity and having the knowledge on where to refer that individual, that patient out. Our facility is small enough that our providers are all well aware of my services, and that referral is a pretty easy go-to. Our facility specifically also has care coordinators, which I think are a really good asset, and have a really good knowledge on what's available out there for options with food and managing maybe some of those food insecurities. But it is important for that provider to really understand the need for that and being able to ask that in their time with that patient.
I think a unique model that I've seen recently, Nil, is that Primary Children's Medical Center is offering a food pantry within their hospital facility. And so once a provider screens for food insecurity, they can walk them down to the food pantry, and the family can immediately receive about 48 hours worth of food supplies at that moment in time. And we've tried to cross-coordinate with them with the WIC system to provide more longer-term resources in that connection point as well. So providing resources to apply for SNAP at that point and to apply for Medicaid. But I think that's critical and a new innovative idea that maybe other healthcare systems could implement to bridge that gap.
Yeah, this is an interesting question because while poor diets are a leading cause of poor health, obesity, and even death in America, nutrition is largely missing from the conversation within the healthcare system. So it's really encouraging to hear about these programs that Matt and Rachel mentioned. We like to refer people to things like Feed UT, which is a program supported by Salt Lake County and other community partners, basically matches people with pantries and ready-to-eat meals. So things like that being more readily available. And you mentioned food as medicine. So Center for Medicare and Medicaid Services begun testing food as medicine, which, as you mentioned, is a response to the growing awareness that food and nutrition is sort of missing from that medical services component. So the Biden administration is approving requests in certain states for Medicaid to cover nutrition interventions aimed at the big goals, right, to reduce healthcare costs. But these are things like produce prescriptions and medically tailored meals or groceries, using healthy or tailor-managed diet plans to alleviate chronic diet-related diseases. And I would love to see something like that happen in Utah, where Medicaid could potentially cover a food as medicine option for people in addition to these other programs.
I think there's a lot of room for people to take that approach, especially since, speaking personally, I've seen a lot of concern from the emergency food system, from existing food pantries and food banks towards the nutritional quality of the foods that they're providing. It's something that they're very much aware of as a pressing concern. And I'm sure that there definitely could be a convergence of interests on that front. And I think along those lines, when we're talking about food pantries and the emergency food system and the efforts that they put forward towards addressing food insecurity, there are a lot of challenges that they have just as a part of their approach. I mean, obviously, they're beholden to the food that they can acquire through donations, through subsidies, et cetera. What do you think the roles and some of the challenges that they're obliged to face when it comes to people with restricted diets, say kids who have already developed diabetes or on specific nutritional plans? What are some of the opportunities for emergency food to start speaking the language of food as an aspect of medical care?
Yeah, this is a really good question, and just kind of brainstorming a little bit on ways to offer certain specific issues with nutrition related dietary needs. which can be really difficult because, like you had mentioned, they just have what they get. And unfortunately, a lot of those foods are longer shelf-stable foods, maybe a little bit more processed foods. I think it would be really helpful if I don't know if this would ever be an option, but having somebody on staff at maybe those pantries that is a little bit more aware of dietary needs and could maybe create specific meals based off of what's available. So somebody that's well educated and knowledgeable in some of those issues. I'm thinking about some pretty severe ones like a peanut allergy or celiac disease where some pretty bad reactions can happen with a certain intake, and just the need of that to help those individuals and creating a plan for them, I think would be a really cool thing to have.
Yeah, absolutely agree with that. And for people living with dietary restrictions, food insecurity presents an additional huge challenge. So food catering to specialty diets is more expensive than traditional food. If use celiac as an example, a lot of times gluten-free products are up to 160% more expensive than their glutinous counterparts. So if you're going to the store, that's already a huge challenge to overcome. A lot of food banks, as mentioned, are working with what they have, and they're doing a great job, but they lack the resources to accommodate for the most part. And there are some food banks throughout the country that cater to those with food allergies and things like that, though I don't know necessarily of any in Utah. There's an organization called Food Allergy Research and Education Fair, and other organizations that provide food pantries with education and materials on how to cater to people with dietary requirements and other allergies. And maybe that could, I think what Matt mentioned, if there was somebody on site to help coordinate, that would be just a huge boon.
So talking about some of the limitations and constraints that people are operating on, obviously, one of the things that's true for food pantries more broadly is true for communities as a whole. We don't actually emphasize that the term food deserts as much as we used to, just because it doesn't necessarily reflect the way that people actually go and shop for food. But recently, the Utah Department of Health and Human Services put out the Utah Healthy Places Index. It's an interactive map that looks at a bunch of different indicators of health, one of which is food insecurity. And coming through that map, they're just looking through the data, it's very clear that where you live impacts your ability to access food and a host of other health concerns. And I'm wondering, like, okay, we've talked about how emergency food plays a role in these systems. We've talked about how hospitals and medical providers play a role in these systems. But what can we do to actually work at a community level, at the not just like cities and towns, but individual neighborhoods, to make it easier to access food, to make your community less of a barrier and more of an opportunity to live in a healthy way?
Yeah, well, I want to start by saying that the tool, the Healthy Places Index, is such an incredible tool. And I think for a lot of folks in our space, one of the takeaways from the pandemic as we emerge out of that is old data and place-based data is not sufficient for the work we're trying to do. So this is an appreciated tool that can get down to the actual tract of what a neighborhood is, so we can focus narrowly on the needs of what each communities are. And like you mentioned, this sort of validates a lot of and confirms a lot of our suspicions, is that these are intersectional issues. If a community is struggling with food insecurity, they're likely struggling with housing or poverty and other things like that. And so we sort of know that that those are multifaceted issues in there. And we also know that most of the time in these communities, there are either formal or much more informal groups doing heavy lifting to uplift their communities. And this is an opportunity for us to engage with those groups, like faith-based organizations, people already doing this work that maybe could use more resources and things like that, to sort of go in and see where the work is being done, and what can we add to it. And at the Heart Association, we've partnered with faith-based organizations like Calvary Baptist Church to help them with food screenings and direct their congregation towards resources and things like that. But that's just, it's a tiny, I guess it's a tiny small instance that means a lot to a single community that that, could be used as a model. And I think a lot of us are already doing this sort of work.
Yeah, I think that was excellent, Noah. I think I can give a specific example here in Utah of some barriers that we might experience in more rural areas, like down in San Juan County. We have a lack of cell towers and internet services. And one complication that we see within the WIC program is that our technology that we require for our card to work in some of these smaller grocery stores is internet and cell phone services. And so I think it is just this intersectional problem where this community is lacking just resources in general that other people don't have. And so working maybe with legislators to get, the bandwidth to improve that throughout the whole state could then increase equitability for people throughout the entire state.
Yeah, I think it can be really difficult in various areas. I think about Ibopaw Reservation that borders out there, Nevada and Utah, and they are a good hour away from any type of grocery store, gas station, anything. And so just getting the food is quite a trip for them. And so it definitely hit that food desert issue out there. And also a lot of the patients I deal with here downtown Salt Lake with a lot of mobility issues and just getting to the grocery stores is a big barrier. They'll come in and tell me how they just usually do most of their grocery shopping at 7-Eleven, and they'll pick up a salad or a fruit bowl there and just increase the cost of some of those food sources. Like I was looking at the banana today, which was one banana was $1 at 7-Eleven. Compared to Smith's was 25 cents. So the healthier foods that they're buying at these convenience stores are just, fourfold in cost and can really put a pretty big impact on their wallet.
So I think that's a very important point. This is one of the figures that we cite in a variety of contexts because it's important in a variety of contexts, is that the cost of food is increasing. We draw on reports from the Urban Institute showing just at a state by state level and showing that over the last few years, there's been a 27% increase in the cost of just an average moderately priced meal in the state of Utah. And like that's sort of a multiplier on whatever other issues that you have taking place. And obviously, like there's going to be a variety of responses to that, but how do you think that increase in cost is impacting people's ability to eat in a healthy way? And are you seeing like strategies that we wouldn't expect? I mean, I know like with the food banks, we've seen something like, okay, well, we're relying more on like shelf stable things or processed foods, but I'm wondering if you guys have experiences that show any other approaches like just to the increasing cost of food.
Yeah, I definitely work with a lot of patients that are struggling with that, and especially with the recent decrease in SNAP benefits from the COVID relief that just recently went away. So increase in food costs, decrease in SNAP benefits, and so a lot of struggle with purchasing food. Specifically, I like to work with patients and show them that they can still find a good, healthy types of foods without breaking the bank. I've got some specific documents that I like to give them, cookbooks, meal plans, and it breaks down the costs, and they're really useful, and just show them that these healthy foods don't necessarily have to break the bank every time that you go, and you can still enjoy the food that you're purchasing. So working with them in that way, and just kind of letting them know that some of these less nutritious foods aren't necessarily cheaper. I was just recently looking at a study, and the cost per gram of healthier foods is actually cheaper versus the less nutritious foods are a little less cheaper per calorie, but that's not always a benefit. So.
Yeah, I think one thing at WIC that we try to promote is in times that we need our food dollars, frozen or canned fruits and vegetables can be a good way to stretch the food budget, and they can rinse their canned and fruits to get, excess sugar and salt off of them. Another thing we try to educate our participants about is stretching their food dollars with protein by adding in maybe protein sources that are beans or lentils, or maybe more plant-based and less expensive type protein sources. But definitely it's a difficult discussion that many of our families are experiencing with the unwinding of Medicaid and SNAP benefits, and families are definitely struggling more at this time for sure.
Yeah, it's sort of a lot with the reduction of those benefits, and inflation. And I think, SNAP benefits are pegged to inflation, but I think the current cost of living adjustment is based on 2021 prices, and that's just not realistic necessarily for 2023. So that can that can, in extreme circumstances like during the pandemic and basically all the time, make people have to choose between healthy food or food and these other necessities. So I think, like Matt and Rachel both mentioned, education can be a big part of that. If healthier diets, if that can be accomplished at a similar price, then that's super valuable knowledge for a family to have, and that's where these case by case resources are super important.
So I think I want to jump off of that and call back to something that no one was mentioning earlier, the impacts in terms of stress and mental health. I mean, like there are the abstract things that we've talked about like early on, like the sense that there is an impact. But in light of this very visceral description of trying to access more food, of realizing that your SNAP benefits aren't going as far as they used to, et cetera, I think there's a lot of room to explore both the direct and indirect effects of food insecurity on stress and mental health overall. And it seems to me, and feel free to like bill or rebut or comment on this, that there's a kind of compounding effect there. Like all of these steps that you're describing to eating healthy or doing things require attention, require focus, require you to be in at least some sense of some state of capacity. And I'm wondering what your thoughts are on like the more pernicious effects on mental health might be.
Yeah, that's a good point. When we were talking about this question, I thought of a quote from an article from B.A. Canale in the New York Times. They wrote on food insecurity at the height of the pandemic, and it said, food insecurity is as much about the threat of deprivation as it is about the deprivation itself. The food insecure life is a life lived in fear of hunger and the psychological toll that takes. Then they go on to mention that, like many hardships, this burden falls disproportionately on Black and Hispanic families, who are almost twice as likely to experience food insecurity as white families. So that, give or take that first part from different perspectives, but that you're right, it's a constant stressor, and it goes back to like our hierarchy of needs. Like, do we have the mental capacity, and then also just the time in our day to go to these resources, to find answers, to the effort and time to spend. Because if your basic needs aren't getting met, everything else becomes much more challenging.
I think another issue on the mental illness side too is that oftentimes we see families that come to WIC and they experience a lot of shame or feel stigma by participating within these programs, and that is another barrier that we're trying to overcome within WIC as well, to really promote our program as a public health program that actually saves the U.S. money in the long term by preventing preterm births and helping to reduce these complex healthcare problems later in life. And so I think if families take advantage of the resource, they're actually helping themselves and helping the economy in the long run.
All right, and I hope you guys will forgive me. This is a bit of a vaguer one going forward. But I wanted to jump on a point that Rachel just brought up, is that the difficulty in actually getting people to access a lot of the programs that are available to them. And I mean, it's something that we at Utahns Against Hunger see very frequently. People who don't want to participate in SNAP because they don't want a handout, that, or for WIC too, for those purposes. They don't want the handout. They don't want to be the recipient of charity, et cetera. Often when somebody will call us, they're already at a point where they haven't eaten for a couple of days, and they're saying, well, I never usually do this, which it's really extreme. You don't want people to be doing that. And I hear a bit of it too, as you're talking about like getting people to change habits and eating healthy food also. Like there are a lot of ingrained patterns of behavior and attitudes, and I'm wondering to what extent that like that notion of not wanting to receive charity complicates people trying to actually pursue healthier habits, healthier eating, et cetera. I sort of want to open up really for a discussion of stigma when it comes to this corner of health and policy.
Yeah, I mean, I think it can definitely be difficult for an individual to have to feel like they're not able to provide for themselves or for their family, and just kind of deal with that difficulty of that. I enjoy working with individuals that really do benefit from the programs that are available out there, and just kind of talk them through their difficult time, and letting them know that these programs are set to help you get through this time that you may be having a difficult time with. We have been working with the Department of Health and Human Services for a little bit with the Produce RX vouchers, and those things have been phenomenal. Our patients have loved them. They've been able to use them, going to the farmers markets, going to the Rancho grocery store, and have really loved using those and implementing them into their daily intake, and allowing them to take a little bit more slack with some of their other finances. And so I think once they kind of get into the program and understand it, they are a little bit more accepting.
And a huge component of our WIC services is all the health screenings that we provide for free and the nutrition education. And so oftentimes families that are maybe not wanting to participate as much, I really try to promote that in addition to these healthy foods that they're receiving, they're bettering their family and their situation by gaining all this knowledge, working with experts in the field of nutrition and breastfeeding. And sometimes that will help resolve, some of their concerns. And, we know breastfeeding is really protective for moms and babies long term. And if we can get in and get support for these women right in the beginning, they're more likely to be successful. And so framing it as a way of, this is a service to not only protect your family with food support, but also these nutritional services that increase your knowledge and your skills and your capability to help your family.
Yeah, and we mentioned school meals earlier on, and there's certainly stigma for students as well if they're taking advantage of the school meals. If that's, a separate line or going early in the morning or different lunches, then that creates this thing like, oh, people will know that I'm getting the cheap or free meal, and that creates their own, its own kind of stigma, and that'll make kids not want to participate. It can make families a little weird about it. And one thing we can do is just expand that eligibility to all students at a school, like things like through the CEP, and make sure that everybody at the school has access to those nutritious meals provided by the school, rather than just students. And that can help remove the stigma, in addition to like the paperwork problems and things like that. So we want to think about stigmas when we think about school meals as well.
Absolutely. So I think as we close up, one of the difficulties of doing these is because you're addressing such a serious issue, it's very difficult to end on a high note. So I think rather than trying to force it, I'll invite you guys to talk about anything good that you're working on or that you're looking forward to seeing before we head off. I guess we could turn around, Matt, Noah, Rachel.
Yeah, I guess I can mention a few things that we're working on here. We just recently started a diabetes program that has been really cool to work with our patients and our diabetic population. Just recently got a grant for a greenhouse that we're going to be able to put up, I believe here at our facility. So I'm really excited about that, and be able to address some of the food insecurity with individuals close to our area. And also working with the diabetes program out at the Ibapaw Reservation and working with those individuals. So lots of really cool things, lots of positive things that we're working on, and just really increasing the availability of food access for some of our patients.
Yeah, I think sort of coming out of the pandemic, a couple of school districts in Utah, Ogden and another, kept the free meals going throughout the end of last school year. They saw huge participation rates. So they just saw the continued success, meaning children are utilizing this, and it's reducing hunger in those districts. That coupled with the things I mentioned earlier, the passage of legislation in neighboring states like Colorado, and basically popping up all over the country for what they call healthy school meals for all. I think there's a national dialogue around this as a policy solution for childhood hunger, at least in this area. And I think that conversation is happening here in Utah. And hopefully we can do some positive things over the next few legislative sessions. And, that's going to be a huge effort and include all of the conversations we've been having today. But I do see momentum there, and hopefully we can keep that going.
And for the WIC program, I think two really incredible feats that are on the horizon is one, our food packages through USDA are hopefully going to go through a revamped change. And prior to the pandemic, children were only receiving $9 in fresh fruits and vegetables, and women were receiving $11 per month. And if this food roll gets made permanent, that would move to $24 in fresh fruits and vegetables, fresh and frozen fruits and vegetables for children per month, and then between $43 and $47 per month for women, which I think would be incredible to help improve their access to these healthy produce options. And then Utah WIC specifically, next summer we'll be moving to a remote benefit type issuance where we have our current EWIC cards that we can reload benefits in the clinics currently, but next year we'll be moving to a technology where we can reload those remotely, which will ease the burden of transportation for many of our participants greatly. So two big things for WIC that we're very excited about in the coming months and years.
That's great. For our part at Utahns Against Hunger, we will most certainly also be eyeing the possibility of expanded school meals very eagerly. And also coming up next month, we'll be conducting another issue forum, this time on food insecurity and veterans here in Utah. So stay tuned for that. To everybody out there watching the video, thank you for joining us, and thanks very much to all of our participants. I hope everyone has a nice day.